I am working as a PGR gastroenterology, and I come across many patients coming to us with complaints, epigastric pain, postprandial fullness, early satiety, and dyspepsia related symptoms. There is a lot of controversy in the terminologies and how the people describe, and even the doctors understand all these terminologies differently. So in a shortest time possible, I would like to give an important message that people often confuse gastroesophageal reflux disease with dyspepsia. Gastroesophageal reflux disease is a different thing, where you have possible lower esophageal sphincter relaxation, or there are other mechanisms involved. But the main thing that is important is the reflux of the acid, leading to the burning chest pain, other symptoms associated with acid reflux. But the dyspepsia is different, and the dyspepsia is actually a symptom complex in which epigastric discomfort, epigastric pain, postprandial fullness, early satiety. If someone is complaining that they feel their abdomen is being distended after eating food, or the abdomen become easily distended after taking food, or they say previously I was eating more but now I eat less and become full. Other than this, they think I don't feel good along that part of the abdomen. They are trying to say that they are having some kind of epigastric discomfort, and sometimes they say I have pain over here, and that is epigastric pain. So keep in mind that the GERD is a different thing, dyspepsia is a different thing, and some people write it APD. I don't think so. APD is any kind of a diagnosis. It is somehow an explanation for those people who are having ulcer because of the acid peptic disease. In the last, it is the functional dyspepsia. So people who are having symptoms falling into the category of dyspepsia, once they have all their investigations done and there is no obvious cause, for example, you have gone through endoscopy, you have gone through H. pylori eradication, and all those investigations that could have explained your symptoms, now the only thing that remains is that it can be called as functional dyspepsia. So functional dyspepsia is a different thing, and organic dyspepsia is a different thing, and sometimes the term uninvestigated dyspepsia also comes across, and that means the patient is only having symptom and you haven't done any workup and haven't proved any cause for it, and also you haven't gone through endoscopy. Remember, next time when someone complains that they are having epigastric pain, do carefully rule out either it is just a simple epigastric pain or it falls into the category of dyspepsia, or they are having symptoms more suggestive of the gastroesophageal reflux disease. Also, there is some kind of controversy as well about the hiatal hernia. People think that have some hernia that is leading to dyspepsia. Actually, hiatal hernia is a risk for acid reflux, and once someone is having reflux and that is pathological, and the pathological means bothersome and with symptom and with endoscopic changes on endoscopy, that we call as reflux disease, because a little bit reflux is normal in normal humans. So we feel some kind of acid coming back after eating a lot of food and suddenly lying down. That's normal. Just one simple episode do not mean you having gastroesophageal reflux disease. So be clear about the reflux disease and non-esophageal reflux disease. You can say NERD, and dyspepsia, uninvestigated dyspepsia, functional dyspepsia, and organic dyspepsia.